Thank you, Mr. Vice President. And it's really a moment that we want to call on every American to increase their vigilance. And I want to go through some data about why we are asking people from Elko, Nevada, through Denver, Colorado, to Philadelphia, from Madison, Wisconsin, to El Paso, Texas, and across this great nation to really increase their vigilance at this moment. I want to thank the governors and mayors and county commissioners that I've had the privilege to talk to over the last 4.5 months of being on the road. We can have the first slide, please. The number of universities, 42 states, 30 universities, and a large number of chairmen from our tribal nations. The reason we wanted to really be and hear is to really understand the reality on the ground, what they were facing, and understand how we could be more supportive. And this is really a call to action for every American to increase their vigilance because of the graphic that is shown here. I wanted to show you the difference in slopes between the spring surge, the summer surge, and the fall surge. So the American people know that this is more cases more rapidly than what we had seen before. But to also make it clear, like before, we do know what to do. And we're asking every American to do those things today. The next slide shows our increase in test positivity. The light brown bars are the number of tests that were performed. But even with the number and ever increasing number of tests performed, you can see the increase in test positivity to around 10%. In some areas of the country, it is much higher than that. And it illustrates the ongoing community spread in your counties, in your small and large metros, and in your rural areas. The next slide really shows the country as a whole and why we're asking every American to remain vigilant, to do those things that we have been asking you all to do, to wear a mask, to physically distance, to continue your hand hygiene, but really in this moment of bringing people together, to really limit interactions indoors to immediate households when we see this level of community spread. Behind this level of community spread is a lot of asymptomatic cases. People are spreading the virus because they don't know they are infected with the virus. And so people are coming together indoors. Everyone looks healthy, but among those individuals could be individuals that already are infected, have no symptoms, and are unknowingly spreading the virus to others. It is because of this asymptomatic spread that we have asked people to wear masks indoors and to ask people to wear masks when among others. But sometimes when we go indoors and we're with friends and family, we just assume that if you look okay, you are okay. And now we know that over 50% of the individuals, particularly among those under 35, many could be infected and unknowingly spreading the virus. This virus increased so rapidly because there was an unusual cold snap that began in the northern plains and went down through the heartland, where in the end of September, beginning October, a large number of people moved indoors. So we've been going across the country to really tell the Mid-Atlantic states and the Northeast to really increase testing, looking for these asymptomatic cases. And I really want to thank the governors across this great land who have really heeded that call and set up what we call sentinel populations, whether it's nursing home staff, K through 12 teachers, whether it's community college students, county workers, specific businesses, to really have routine weekly testing so that we can see the spread of this virus down to the zip code and really combat that with additional mitigation. The next slide shows what we have been talking about the level of hospitalizations. And in this slide, you can see the hospitalizations by the darkness of the color, and I just want to make it clear what the Vice President talked about. We now can see every admission every day, and I want to thank the hospitals who from July have been sending us that data and improving that data and working with CDC so that we can see new admissions, we can see inpatient status, we can see ICU status, and we can see who's being admitted by age group. Right now it's about 50-50 between those between 40 and 69 and those over 70. But you can see that we have some areas of the country in the hot red, bright pink. And these are the darkest red are those states that have more than 21% of their hospitals are COVID patients. and the light pink is between 16 and 20%, and the light orange between 12 and 15%. But you do see that there's still states in the green areas, and to all of those states that have not seen this surge, to really increase your testing among asymptomatics by setting up these sentinel populations. When we did the 45 days to stop the spread and we asked each state to follow the gating criteria, part of that gating criteria included looking for asymptomatic cases. With these new antigen tests, we have the capacity to really expand testing to find those cases and stop that spread. In the meantime, as we started with, we stopped the surge in the South through very targeted mitigations that start with masks, that start with physical distancing, but also include decreasing those friends and family gatherings where people come together and unknowingly spread the virus. And I want to thank the mayors of Miami, Miami City, and Miami County, who they were the ones that first in the summer really found how much asymptomatic spread was occurring in household gatherings. And so as you bring together individuals, remember what the Vice President talked about. Every American needs to be vigilant in this moment, because we know that when you are, we can mitigate this virus and stop this spread together.